as it may, we're going to be using the the buprenex because it's got very good pain control, as opposed to butyrophenol, which has got good sedation, not good pain control. Buprenex has got good pain control and an average sedation. Right? So that's what I would use. Makes the cat easier to handle, reduces the stress of the cat, reduces the pain. So that's what we're going to use. Midazolam, we're going to use buprenex, and mix that, give it IM, wait for like 10 minutes, mask the cat, fine. So now the cat is anesthetized. What are we going to do? You could try, once the cat is anesthetized, I'm going to get the ECG on the cat, okay? And then we're going to start. You're going to try to squeeze the bladder of the cat. Maybe it will squeeze. I wouldn't be so hard on it. No, I would try. Then the other thing is, well, it didn't squeeze. So what do we do now? We need to get the penis out. Getting the cat's penis out is not something that's easy, and stabilizing it out is not easy either, unless you've done it before. If you're new, or if you've never seen it before, or this or that, yeah, it's not easy. So here's what I would do. And again, that's like my personal technique. So let's assume that this is the cat's head. It's on that side, it's on my left side. I'll have my assistant lift the cat's legs like this. And then I'm gonna get this thumb here of my right hand, and I'm gonna go at the scrotum, and I'm gonna press it like this. Do this. Press it in and down like this. You do that, the penis comes out, and then you'll be holding it like this. Okay. So one thing that you need to know is, I'm sorry for that, but if that's the cat's penis, then this, you see a faint line here. That faint line marks the presence of a piece of tissue that's like, it's like a loose, like a sleeve, okay? So you can hold it and use it to manipulate the penis, okay? So now we've gotten it out by pressuring the scrotum. It comes out, we hold it like this from behind the line by this piece of tissue. What do we need to do? We need to pressure it down so that it is, the cat's laying on its back, so that it's parallel to the spine. If it's up, then that means that there is a curve, and the curve will prevent you from being able to flush the stone, okay? So we pressure it down, it's parallel. What do we do after that? Well, you use the best one to use, in my opinion, is olive tip catheter. Olive tip catheter is like a metal catheter that's got the head it looks like an olive tip. So this swollen tip makes it easy for you to, we'll get it in the penis, and then we're gonna like hold it, okay? We're not trying to push the stone with the catheter. That's bad, and that can rupture the urethra. We're trying to just flush it. We're gonna hold it, and then we're gonna start pumping the fluid. Usually I have the assistant do that, like a 5 cc syringe. And then if I'm blocking the bladder, I mean the urethra, around the olive tip catheter, then the fluid is going to distend it, and then when it's distended, then the fluid will, because it cannot go the other end because I'm blocking it, will go forward, flush the stone. So what do we do when we've flushed the stone? We would empty the bladder gently, and then we would pass a catheter that's going to be permanent. So the recommendations have changed, okay? So what do we do after we unobstruct the cat? The recommendations have changed. You place a catheter for 24 hours and then you pull it, okay? After that, do not use antibiotics. The cat's going to need to have a collar, because one thing that you don't want it to do is you don't want the cat to bite the end of the catheter, and the catheter is in the bladder. That's bad. I've never seen it happen. I don't know if it could happen, but yeah, it's a nightmare, so I don't want to go there. So the other thing that's important for me to mention is when you're getting the Tomcat catheter in, again, in my experience, that's been very hard to do that. You need to attach a syringe to the catheter, and you're gonna like introduce the catheter in the same position, again with the penis down to be parallel to the spine, and you're gonna need to, either you or an assistant, be flushing fluid through the catheter as you're introducing it. Flushing the fluid lubricates and opens the bladder, the urethra, for the catheter to slide in easily. If you are doing everything right but you're not flushing while you're introducing the catheter, in my opinion, in my experience, it just doesn't work. In my hands, it doesn't. So we've got it in, we'll fix it, and we're gonna flush the bladder. You're gonna use flushing the we're gonna use the fluids to flush the bladder of the stones as much as we can, and we're gonna have the cat with the catheter. Now, do you necessarily need to leave a catheter in? Again, that's something that you probably need to refresh on, or maybe consult some recent critical care recommendations. But in my opinion, most cases yes, but again, not necessarily. If you've got a really concentrated urine, even if it was, so the things that they say affect that. What does the urine look grossly? Okay, that's what helps you get a prognosis of how bad, how severe the case is. Well, is this urine clear? Does it look normal? Or does it look bloody? Or does it look just like blood? Okay? So if it looks really grossly abnormal, that's an indication that we definitely need to leave the catheter, and we might even, the recommendation before was to leave it longer than 24 hours if the urine is looking that bad, but now they don't. But that would be an indication what the urine is like, and that you can compare that to what it would look like when the urine is actually when the cat is under treatment. Is it looking better? Is the urine looking better? That's one thing. The other thing is they say, well, how difficult was it to obstruct the cat? So some cats is just like introduce the olive tip catheter, it's gone. Very good stream, we're fine. That's an easy one to unobstruct, and if it's easy to unobstruct, chances are it doesn't have lots of mucus, it doesn't have lots of stones, so that's another indication. So if you've got a really grossly abnormal urine and it's hard to unobstruct the cat, then you definitely need to leave the catheter. In most cases, I think the recommendation is still to leave the catheter, even if it was easy to unobstruct the cat for 24 hours and then you pull it. One thing to know is do not give antibiotics while the catheter is in, because the catheter will form a biofilm. What does a biofilm mean? A biofilm means something to shelter the bacteria from the antibiotic concentration. The bacteria will be adherent to the catheter, and that will give the bacteria a shelter from antibiotic. I guess that's the theory. And then the bacteria will get a taste of the antibiotic but will not die, and that will build resistance. Whatever the case may be for the explanation, antibiotics while the catheter is in builds resistance. I think that's something that you're likely to come across if you're taking the boards. So let's get back. We left the catheter 24 hours. Need to let the owner know. Leave it for 24 hours. We pull it. Wash for 24 hours again after we've pulled it. So the whole of the wash period is going to be 48 hours. 24 the catheter in. Remove the catheter another 24 hours. If the cat is not having problems urinating on his own, then he's kind of like done for that. Okay, so what do we do after that? Well, one, we're going to need to send the urine for analysis to see if there's an infection. Most of these cats that have the blood in the urine, whether obstructed or not, do not have an infection. I mean, 10% of them might, at least in my experience. Again, usually the older cats, the young cat that's 1.5 or 3-year-old probably doesn't have an infection. I'd be really suspicious of an infection in that urine, but yeah, we'll see. We'll send that urine out. Then we're going to need to put the cat on a urinary diet. The two most common, I hope I'm not advertising that. I mean, there is CD by Hills, C as in cat, D as in dog, diet by Hills, and there is UR by Purina, and that's it for the diet. There is a new product from Purina called HydraCare. HydraCare is a supplement that will make the cat drink more. Well, what other strategies do we have to get the cat to drink more? Well, get a water fountain that makes the cat drink more. You can add tuna water to the cat's water. Make sure it doesn't. It's not left out in the summer because that makes a broth and can cause bacterial overgrowth. So I would not really leave it out for, I'd say, longer than 12 hours maximum, especially on a hot day. But yeah, that's a way to get the cat to drink more. And if you're giving the cat canned food, the cat will be drinking more or getting more fluid than if you were giving the cat dry food. So that's what you would do for the diet. The other thing is you want to reduce the stress in the cat's environment to avoid the condition that causes the obstruction, which is the feline lower urinary tract disease, which is stress-induced, sterile-induced, does not involve bacteria usually, type of inflammation in the bladder. So how do you reduce the stress? Well, litter box management. You need the number of cats plus one. Have 2 cats, you need 3 litter boxes. You have 3 cats, you need 4 litter boxes. Well, what else are there than litter box? You need the litter material. Cats do not like scented litter material, and cats do not like the non-clumping type. So you want a clumping, non-scented type of litter material. Well, if you've already got a litter material that they're using, maybe you don't want to do a sudden change. Even if they're using their own type of litter material, just get a box with the new type that's not scented, that's clumping, and see if the cat will use that one. Also, cats don't like hooded litter boxes. Remove the hood. The litter box needs to be big enough. So it needs to be big enough for the cat from the tip of the nose to the tip of the tail. That makes most litter boxes available in the market too small. Go to Walmart, buy a litter box, cut the window in it. Get a clear box, cut a window in it, and then put it as a litter box for the cat. So that's for litter box management. Cats also need toys. You need to use food toys. So again, the ideal diet for the cat is canned food is the main food, and then the dry food only goes in the toys. There is a website called foodpuzzlesforcats.com. You go there, pick some food toys, and put the toys in it, and always start easy so that the cat would get rewarded by playing, and then it can get more difficult. The toys are graded by difficulty, but also a simple rule to follow. A toy is more easy to get the food off if it's overfilled. If you have little amount of food, then it's harder to get the food out. Litter box management, use the right type of litter material, non-scented clumping, they don't like the scent, non-scented clumping, and then use the food toys. What else? Well, get a water fountain, as we said, and get a high hiding place for the cat. The cat wants a place that's elevated from its surroundings to be able to get on top and watch its environment, and also if it can look at the distance, that relaxes the cat. Best setting, elevated scratch post by the window. They'll climb, and if you have something like that, you'll notice the cat always goes there. That helps reduce their stress. It's like meditation. Fourth, avoid changes in the environment. If you have to get another cat, or if the client has to get another cat, let them know. You get another cat that can stress the one that gets obstructed. So something to consider. Introduce the cats gradually, meaning that you put them somewhere where they can only probably smell each other but not hear each other. At least you cannot hear the other cat from where this cat is. And then you get them closer to where you can hear the cat, which means that probably the cat can hear the cat. And then you, third step, introduce them through a barrier. They can not only hear, but they can see each other through the barrier, and then you remove the barrier. Again, that does not guarantee that it's going to go well, introducing the cats, but that reduces the risk as much as we can. Best solution, do not change the household. Do not change the number of cats. Do not change the humans in the household. If you do any of these, owner travels and comes back. It's usually when we see the blood in the urine, owner calls and says, well, I came back from a 10-day travel and there's blood in the urine. So if you cannot avoid these situations, at least know that predisposes the cat to blood in the urine, possibly being obstructed, and be on the watch. Okay? Make sure that you can find the cat. Because if the cat is hiding, it might be hiding because it's in pain and it's obstructed and we don't find it. Okay? So what do I need to mention finally? I need to mention finally the things that can happen after we've treated the cat, and we need to mention them to the owner before the treatment so that we're not accused of causing the damage and then trying to justify it. Okay? That's very important. Mentioning the possible complications before the procedure, even though there's no way to avoid them, is totally different than mentioning them after the procedure. The human perception is different. What you need to mention is, one, you could have an atonic bladder. What does an atonic bladder mean? Bladder got stretched so big to the point that it cannot empty now, and this cat would need to be voided manually. A human will need to squeeze its bladder. You can imagine what kind of stress that would put on owning a pet. The owners need to know that. Run the blood work, you get elevated beyond creatinine, really big bladder, you tell them, well, we're going to empty it, but it might not regain its function. Other thing is, if you've got elevated beyond creatinine, well, that can damage the kidney by back pressure to the kidney from the obstructed bladder. So we tell them, well, you're going to need to diurese him for 24 hours, as I mentioned that before. Okay, that video has been an hour long. That's way longer than I expected. I'm going to try to upload it somewhere. And thanks for listening. If you have any comments, especially if it's boring because I'm repeating myself, then yeah, let me know. Thank you.